Hey everyone, and welcome back. We love digging into these complex medical topics, and today is no exception.
No, not at all.
We're doing a deep dive into refractory postpartum hemorrhage, refractory PPH for short.
Yeah.
We're looking at a recent review article on it,
Okay.
and we really want to give everyone listening the tools and the knowledge to really understand this condition,
Right.
the latest treatments, and why it matters so much for moms.
Yeah. And what's fascinating about this is that it's not just your typical bleeding after childbirth.
Right.
We're talking about the cases where standard treatments aren't quite enough.
Yeah, it's like
Okay.
stepping it up a notch in terms of the medical
It
intervention.
is a higher level. Yep.
So let's start with the basics. How does this recent article define refractory PPH?
Well, they define it as a hemorrhage requiring what's called a second-line interventions.
Okay.
So that means that the initial methods to stop the bleeding haven't been effective. So we need to bring in the big guns.
Okay, so like what would those be? Paint a picture for us.
So, a new mom might need like 3 or more uterotonics.
Okay.
Those are medications to help the uterus contract.
Yeah.
Or she might even need a uterine balloon tamponade.
Okay, so that's where they insert a balloon to put pressure.
Exactly.
Wow. So it's really a step beyond just simple bleeding.
It is, absolutely. And what's important for everybody to understand is that this is a more severe form of postpartum hemorrhage.
Right.
And it's a major concern because of all the complications.
And this isn't a small number of women, right?
No, it's not a rare thing. Studies estimate that refractory PPH affects about 10–20% of women who have postpartum hemorrhage.
Wow.
So it's a significant portion.
Yeah, so really understanding what causes this is really important. You would think that excessive bleeding, it seems like it would be kind of straightforward,
Yeah.
but it sounds like there's more to the story.
There is.
So what are some of the surprising things that are now on the radar for medical professionals?
Well, it's not always so simple.
Right.
So while the most common cause of postpartum hemorrhage in general is uterine atony,
Okay.
where the uterus just doesn't contract properly after delivery,
Right.
refractory PPH is often more complex than that.
Okay, so if that initial round of typical treatments isn't working, what else are they looking at?
So 2 other major culprits that we see are things like obstetric lacerations, tears that can happen during delivery,
Right.
and then also abnormal placentation,
Okay.
which means the placenta just doesn't implant the way it should.
Right.
So both of these can complicate bleeding.
Yeah, you're dealing with potential blood loss from different sources.
Exactly. Exactly. And to make matters even more challenging, sometimes the cause of the bleeding isn't obvious right away.
Right.
So it's this medical puzzle of figuring out what's going on and how to stop it.
And that's where early detection is so important.
Oh my gosh, yeah.
Catching it and being able to intervene.
Absolutely. Early detection and management is paramount.
Yeah.
And, medical professionals are now using a variety of different techniques to accurately assess blood loss.
Mm.
And it goes way beyond just eyeballing it.
Okay, so what are some of the things they're doing now?
Well, one that's becoming increasingly common is what's called quantitative blood loss measurement, or QBL.
Okay.
So think calibrated drapes, meticulously weighing blood-soaked materials.
So just being very precise about actually measuring every drop.
Precisely.
Wow.
And then it gets even more high-tech than that because we have these mobile monitoring systems that actually use image recognition to measure blood loss in real time.
Hold on, image recognition.
It's like something out of Star Trek.
Yeah.
So one example is the Triton system, where you can take a picture of a blood-soaked sponge with your phone or tablet, send it to a remote server, and it will analyze it and give you a very accurate reading of hemoglobin loss.
That's wild.
It's pretty amazing.
That's incredible. But even with early detection and these great tools, what happens when those typical first-line treatments for PPH aren't effective? Is that when we get into these second-line interventions?
That's exactly right. That's where this review article really digs into some of these medical therapies.
So we know medications like oxytocin are often used. What happens when that's not working? What else is in the arsenal?
Well, one of the key players in treating refractory PPH is a medication called tranexamic acid, or TXA.
Okay.
It's an antifibrinolytic, meaning it helps prevent those blood clots from breaking down, giving the body a fighting chance to control the bleeding.
So it's like reinforcing those mechanisms that are already there. And I know there's been some promising research on this, right?
There has. The Woman trial, which was a large international study, found that giving TXA within 3 hours of birth significantly reduces the risk of death from postpartum hemorrhage.
Those are amazing results.
Yes.
Are there other medications too?
Yeah, so another approach is using something called fibrinogen concentrate. So fibrinogen is a protein that's crucial for blood clotting, and during a hemorrhage, those levels can really plummet. So replenishing those levels can be really helpful in giving that clotting process a boost.
It's about giving the body the tools it needs to do what it needs to do.
Yeah,
But like any medical treatment, I'm sure there are risks, right?
you're absolutely right. No medical intervention is without risk. But studies have shown that TXA and fibrinogen concentrate have a relatively good safety profile when used appropriately. It's always this balance of benefit versus risk.
Finding that sweet spot, yeah. But what happens when we move beyond just medications? What about surgical interventions?
Surgical interventions, huh?
Yeah.
That's where things get really interesting.
It's amazing to me how medicine keeps evolving.
It is.
Like finding these new ways to tackle these challenges, it feels very futuristic, but instead of spaceships, we're talking scalpels.
That's right.
So when we're talking about refractory PPH and surgery becomes necessary, what's kind of the main goal?
Well, I like the way you think.
Yeah.
It is pretty remarkable what's being done. So the primary goal is always to control that bleeding while also preserving the uterus if we can.
Because, yeah, ideally you want to avoid a hysterectomy.
Right.
Unless absolutely necessary, because it's not just the physical health, but there's the emotional and psychological impact as well.
Absolutely.
Yeah.
And so surgeons have developed some really interesting procedures to try to achieve that balance. And one that I think is interesting is the use of uterine compression sutures.
Oh, wow.
So picture this, the surgeon uses a special suture to actually compress the uterus, almost like tightening a drawstring bag,
Oh, wow.
to encourage it to contract and control the bleeding.
So it's like lending a helping hand to the uterus, giving it that support from the outside.
Exactly.
Are there different types of these compression sutures?
There are, yeah. And the most common type is called a B-Lynch suture,
Okay.
named after the surgeon who developed it. And it's been a game changer for a lot of women.
The B-Lynch suture.
Yeah.
But, okay, let's say those initial steps, even the compression sutures, aren't quite enough.
Right.
What happens then? What are the other options?
Then surgeons will often turn to procedures that focus on the blood vessels directly supplying the uterus.
Okay.
So it's about targeting the source of that bleeding.
Getting right to the root of the issue, which I imagine takes a lot of precision.
It really does. And one procedure that's been revolutionary in treating refractory PPH is uterine artery embolization, or UAE.
UAE, right. And that's less invasive than traditional open surgery, right?
It is. So instead of a major surgery, a radiologist will use a catheter to inject these tiny particles into the uterine arteries. And these particles block off the blood flow, stopping the bleeding.
So it's almost like turning off the faucet from the inside?
Exactly. And the really cool thing about UAE is that it's highly effective. And it's got a really good safety record. In fact, studies have shown that UAE successfully controls bleeding in more than 85% of refractory PPH cases.
That is really good to hear. But of course, no medical procedure is without risks. What are some things to consider with this one?
Well, you're right to think about that. While UAE has a relatively low complication rate, there's always that chance of infection. Maybe allergic reaction to the contrast dye used during the procedure, or in very rare cases, some damage to surrounding tissues. So again, it's about weighing those risks.
Right, right. And I imagine for some women, even UAE might not be an option or it's not successful.
Right.
So in those really challenging situations where you've kind of exhausted other options, is a hysterectomy the only other path?
Well, it's definitely the last resort. It's a very difficult decision, and it weighs heavily on everybody involved. However, there are times when it's the only way to definitively stop the bleeding and prevent those really serious, potentially fatal complications, ultimately saving the mother's life.
Wow. It really speaks to just how serious refractory PPH is.
It is.
And these really skilled medical professionals who are making these decisions in these really intense situations, it's amazing.
Yeah, it is. And it brings up a very important approach in those most severe situations called damage control resuscitation.
For DCR.
Damage control resuscitation. Okay, so what does that involve? Think of DCR as this highly specialized, multidisciplinary approach to managing those absolute most critical cases of refractory PPH, especially when a woman's body is going into shock from the blood loss. It's about stabilizing her entire system, her blood pressure, her body temperature, her blood's ability to clot.
So it's like a full court press by the medical team to support her body in healing itself.
That's a great way to put it.
So what does that look like in a hospital setting?
Well, it often starts with a really rapid assessment of the situation. How much blood has been lost? What's her blood pressure? Are there any signs of organ damage? And from there, it's about aggressive resuscitation. So transfusing blood products, correcting any clotting problems. And if it's absolutely necessary to get control of that bleeding, even a hysterectomy.
Wow, so it sounds incredibly intense.
It can be, yeah.
Like a race against time?
It is.
Hmm.
But, DCR is about finding a really delicate balance between controlling that crisis, but also making sure that we're looking out for the patient's long-term well-being. It's not a one-size-fits-all approach. It involves multiple phases from that initial damage control surgery to intensive care, and then finally definitive surgical repair once she's stable.
Wow. So it's like this perfectly choreographed medical ballet with all these different players.
That's a great way to put it, a very intense ballet.
Yeah.
But a ballet nonetheless. And the good news is that studies have shown that DCR really improves survival rates for women who are facing those extreme cases. It highlights what's possible when you have those skilled medical teams working together.
It really does. And it kind of brings us back to the heart of this whole deep dive, right?
It does, yeah.
Refractory postpartum hemorrhage is a serious condition. But with early recognition, a multifaceted approach, access to experts, it can often be managed, and women can have good outcomes.
You said it perfectly. It really speaks to the importance of research, education, access to care for all women.
As we're talking about all these different procedures and things like damage control resuscitation,
Right.
it really highlights how important it is to have a good team in place,
It really is.
especially for these high-risk situations.
Oh, absolutely. You need a really well-coordinated team.
Yeah,
I mean, we're talking obstetricians,
yeah.
anesthesiologists,
Right.
nurses, and potentially even interventional radiologists and critical care specialists all working together.
It really is a team effort.
It is.
It's like an orchestra,
I like that.
everyone playing their parts.
That's a great analogy.
So when you're dealing with something as time-sensitive as refractory PPH, what are some of the things that make a good team dynamic?
Well, you hit the nail on the head when you said time sensitive.
Yeah.
It's not just about having the right people there. It's also about having these clear protocols,
Right.
well-defined roles,
Yeah.
and just open communication.
Yeah, because in those moments, there's really no time for hesitation,
Exactly.
for miscommunication.
You got it. And that's where those obstetric hemorrhage bundles that we talked about before really come in.
Right.
It's like their pre-game plan
Yeah.
to make sure that they've got the resources, the training, the procedures all ready to go.
Right. Being prepared for that worst case scenario so that when and if it happens,
Right.
they can jump into action.
Exactly.
That's really reassuring to hear.
Yeah, it's about anticipating those challenges and being ready.
Yeah, and that makes me think about access to resources, too.
Yes.
Which plays such a big role in maternal health outcomes
Huge.
because it doesn't matter how advanced the treatments are
Exactly.
if women can't get access to them.
Absolutely. And, there can be disparities even within the same country
Yeah.
in terms of access to care.
So things like where somebody lives or their socioeconomic status can impact their ability to get the care they need
It's true.
for something like refractory PPH.
Yeah, it's a complex issue
It is.
with huge implications.
And that's why it's so important for us to be talking about it
It is.
and raising awareness.
Yes. Advocating for more equitable access.
Yes.
Supporting research.
Yes.
Continuing to educate.
Because knowledge is power, right?
It is.
So the more women know about postpartum hemorrhage and the potential risks, the more they can advocate for themselves
Exactly.
and seek help if they need it.
Yes, early recognition and intervention is key.
It really is.
It can make all the difference.
Well, I think this has been a deep dive in every sense of the word.
It has.
We really unpacked refractory PPH.
We did. We covered a lot.
From the causes to the treatments to the importance of research and access.
We really did, yeah. It's been great.
It has, and while we've highlighted how far we've come,
Yeah.
obviously there's still work to be done.
Always. There's always more to learn.
There is. So as we wrap up this episode,
Okay.
we focused a lot on the medical aspects of all of this.
Right.
But it's important to acknowledge the human experience as well.
It-
To any woman out there who has faced this complication,
Yeah,
your story matters.
absolutely.
Your feelings are valid.
Yes.
And you are not alone.
You're not at all.
There's support out there.
There is, both medical and emotional.
So please reach out if you need it.
Don't hesitate.
And to our listeners, thank you for joining us on this journey into the world of refractory postpartum hemorrhage.
It's been fun.
We hope you found this deep dive informative and empowering.
We hope so.
Remember, knowledge is the first step towards better health outcomes.
It really is.
For everyone. Until next time, stay curious.